Hello, this is Dr. Siddharth. Welcome to another topic of discussion today, and the topic is on seizures. Seizure or a fit is an abnormal movement of the child's body occurring due to an increased electrical activity in the child's brain. When these seizures or fit happens repeatedly, it's called as an epilepsy. Now, there are various types of seizures. They can be staring episodes, or they can be jerking of one part of the body or the whole body, or they can be falling onto the ground, or 100 other types. Now, what are the causes of seizures? The cause of seizure may not always be found. The other common causes can be injury to the brain, it could be infections, it can be heart conditions, and so on. Now, what are the symptoms of a seizure? A child may occasionally have an aura. That means they may know beforehand that they are about to have a seizure. They can have headaches, they can complain of blurred vision, or they can complain of being uneasy. Following this, they can have the episode of seizure, which could be the jerking movement, or going limp, or just staring into space. Now, all of these abnormalities can happen in one part of the body, or it can involve the whole body itself. In all of these episodes, the child will remain unresponsive during the period of seizure, and they will wake up after the episode. After the episode of seizure, the child may be confused, may appear drowsy or weak or tired, and may sleep for many hours. They can be left with a headache or aching limbs that can last for hours or even days. Now, the next important question is, what do you do in an episode of seizure or a fit? Firstly, don't panic. Second, in any seizure, do not try to stop it. Clear the area around the child. Move the furniture out of the way. Loosen any tight clothing around the neck, and stay with the child until the seizure is over. After the episode of the seizure, place the child in recovery position. Recovery position is the child lying on the side. This prevents certain complications. Now, what are the effects of a seizure? Having a seizure itself does not cause any serious harm. It won't cause any serious brain damage or any internal damage. However, a person might injure themselves. They may bite their tongue, or they may fall to the ground during this episode. Now, how is a seizure diagnosed, or how is it investigated? Once you take the child to a hospital, a number of tests can be done. Simple blood tests can be done to look for the sugar levels, or to rule out infections, or look into the chemical numbers in the blood. Certain tests like ECG can be done to look into the electrical activity of the heart, or even EEG to read the electrical activity of the brain. Occasionally, a CT scan may be considered. Now, what is the treatment? There are hundreds of medications that are available for seizures, and as you know, there are hundreds of seizures. So it is extremely tricky to give the right treatment for the right seizure. It always takes some time to investigate and to begin the treatment. And we are not in a hurry to start the treatment, as the medication for seizures itself come with a lot of side effects, and the treatment goes on for a good few years. So only after all the tests are done and the type of seizure is confirmed that the medications are started. Now, what next? A vast majority of children with epilepsy can lead a full and active life. It is estimated that around 75% of the children with epilepsy will be very well controlled with medications alone, or may even grow out of it in the next few years. Hope this information has been of some help. Please let us know on www.noe.com. Thank you. Take care.